Yeah, go for it.
MedAir is one of the best faith-based humanitarian organizations that I've worked with that really gives people who don't have might have professional background but don't have experience in the humanitarian world, who really gives them a foot in the door. So they come in, if they don't have any humanitarian experience, you do 12 months of what's called the new relief worker. And so it is, you get a stipend. You don't get a full salary, but you get a stipend. It's almost kind of intern-ish, but you really get on the job training. So I've worked with new relief workers who reported to me, who one was a water engineer and the other was a doctor, and they both came in and were on the job training, using their skills and being able to implement and get tons of experience in the humanitarian sector. So MedAir is really one of the best organizations for people who have no experience but have professional skills to come in and get their foot in the door in this sector.
Wow, that's wonderful. That's great piece of information there. So obviously the question on all of our minds, and I know it's top of mind for me as well, is, I'm sure that the COVID-19 global pandemic has obviously affected your ministry with MedAir. I'm sure your things are probably increased in your responsibilities. So why don't you share with us, share with the audience, how has the pandemic changed or affected your ministry at this time? We're like 10 months into this already, and so how does that? How is MedAir adjusted, and how has the pandemic affected the people and the areas in which you serve?
I've been really proud of how MedAir has responded. Just not only programming, like not one single country programming stopped. Everyone continued, and they turned, and we all across the board took on COVID and said, how do we change our programming to accommodate this? And I watched as not only Syria, but like every single country program did this, whether it was changing how we responded in the health sector and how we provided health clinics with protective equipment, or providing health clinics with rehabilitation in infection prevention and control within their clinics, or how we changed how we messaged things. So having to move into phone messaging as opposed to community messaging and face-to-face messaging. And that wasn't just Syria, that was across the board with every single country. And so I was like, it was like this, the change. And then the support that came from our headquarters was incredible. Immediately there was a COVID task team set up. There was professional, like health professionals that are just some of the most respected people in their field. Like there are some people on our headquarters team, in the COVID team, that I just have so much respect for, who have just umpteen amount of experience in the health sector and what they keep feeding the field. So they are doing research, they're looking for the most recent statistics, they are constantly helping us to be able to accommodate our programming. So the support that has come from the headquarters has been phenomenal. And then watching as each country program just shifted, not their focus of their programming, because all the programming stayed the same, but either added more programming or changed their programming to accommodate COVID. And it was phenomenal to watch this massive ship kind of just immediately turn and change course. But it's for certain impacted us. And I watch in Syria, there's very little, we think that numbers are very underreported. There's been a lot of fear around COVID. There's also been rumors that it doesn't really exist. But there is fear around being sent to a government quarantine center, and so people don't go to get tested because they're afraid of it. We've had some of our own staff have COVID, so we've had to implement measures in the office, like wearing masks and things like that, to make sure that we can protect our staff. It's for sure had an impact, and I think we see numbers continue to rise, the reported numbers, let alone what we think are underreported numbers here in Syria. So it's had a huge impact on MedAir, on Syria, but I've watched as God has so faithfully helped us as an organization to respond in an appropriate manner and in a real godly manner, and that's been really exciting to see.
Wow, thank you so much, Raija-Liisa, for sharing with us, what MedAir has done, and to hear that, yeah, even though there's this global pandemic going on, that you didn't shift your focus in your programming, in all the outreach that you do, and the medical care that you do, and the relief work that you do. Is just different in how you approach it, in order to maintain those health and safety protocols. And I mean, as we've been saying all along, for some folks in the world, some of our missionaries, here we are in Canada, and we are so blessed by our healthcare workers, and we're just so encouraged by their essential work. But in some countries, like you were saying, Syria and the others, our missionaries are the frontline workers. Because the governments there may not necessarily have all that there is to combat this pandemic. So we really are grateful for the ministry that you are involved in, putting yourselves at risk, even contracting COVID. I mean, that is truly humbling to hear of your commitment, to the level of commitment that you have to the ministry to which you've been called. Well, again, thank you, Raija-Liisa. Looks like our time is up, and I really hope that we just again thank you for the ministry. We pray God's protection over you and your team and the whole MedAir community. So once again, our audience, if you want to learn more about the work in ministry of MedAir, go to medair.org. And you can learn about that. And maybe someday God may be calling you to go to Syria as well. So then you can meet Raija-Liisa in person. Well, thank you so much. And thank you for watching.